In this clinic in the city of Beni in the Democratic Republic of the Congo, doctors are treating a new patient. It's a 13-year-old girl who recently tested positive for Ebola virus disease. Without treatment, Ebola is nearly always fatal, so time is of the essence. Nearby are more patients. Janine in the white shirt and her two sisters have been here for 3 weeks. 7 members of their family are already dead.
When my mother died of Ebola, we didn't know what it was. We thought she had been poisoned.
Ebola is spread through contact with bodily fluids. A new tool called the Cube allows additional health workers to treat patients from the outside.
Before, it would take 15 minutes to be able to enter the room. Now, in a couple of minutes, we can be helping a patient.
Just a couple of years ago, there were no medicines against Ebola. This year, new experimental drugs are being used.
On one hand, you're incredibly nervous because not many people have given these drugs before and not many people have received them. But on the other hand, there's a sense of excitement and a sense of hope because for the first time we have something that we can use to directly fight against the virus.
There's also a new vaccine. Though it too, like the new medicine, isn't yet fully approved by global health authorities, more than 15,000 people in this region have been vaccinated on compassionate grounds. The goal is to forestall an epidemic, one that could sweep the region and beyond. But this outbreak has other challenges. This part of the Congo is an active conflict zone. More than 100 armed groups are fighting for influence, and Ebola has spread to neighborhoods like this one near Beni, where armed groups regularly operate. Less than a kilometer behind me, armed groups are fighting the national government. During periods of intense fighting, this is a no-go zone for health workers. Shortly after we left Beni, the second attack on the city by an armed group in just 1 month. This time 15 civilians were killed and a dozen children abducted. Because of the unrest, vaccinations and the crucial tracking of suspected Ebola cases are called off. At times, many areas are still too dangerous for health workers to access, so part of the response means training health workers from dangerous areas so that even if they're on their own, they'll be ready.
Local health workers are the first line of defense. All of the sick people who arrive, they come here first. So if these nurses don't know how to protect themselves, they'll be exposed to the disease.
Back at the Ebola treatment center in Beni's Central Hospital, there's a moment of happiness. Today, doctors have the results of Janine's latest blood test. It shows there is no more Ebola. After 22 days near death, she's cured. Now she can go home.
I'm going to tell others how terrible this disease is and encourage them to come and receive care and get cured.
Her 2 sisters will stay behind. Janine says she plans on returning here every day until they too are cured. There are small glimpses of hope when a patient is cured, but there are also new confirmed cases. It's still too early to tell in which direction this Ebola outbreak will go. Jorgen Samso in Beni, the Democratic Republic of Congo, for Euronews.